joining today. I am Carrington Lott. I'm the Deputy Director at Systems for Action, which is a national research program office of the Robert Wood Johnson Foundation. We're located at the Colorado School of Public Health in Aurora, Colorado at the University of Colorado Anschutz. This is a research in progress webinar series. This is an ongoing series that we have. It's a bi-weekly presentation where we invite our Systems for Action investigators and researchers to come and give some live time, real-time updates on their research projects. And today we're going to be hearing from a team at the Morehouse School of Medicine and their partners at Redemption and Advancement Alliance on their research project that was funded back in our 2022 funding opportunity. So the last funding opportunity that we released. If you're not familiar with Systems for Action, all of our projects focus on ways of aligning across systems, so across the medical, public health, and social service sectors. This particular call had a specific focus on structural racism and addressing that through the systems where structural racism is embedded into the medical, public health, and social service sectors. So you'll get to hear about that during this presentation. The presenters today are here to talk to you about their multi-sector approach addressing homelessness among fathers in Atlanta, particularly Black fathers. They're building on top of a coalition of leaders from Fathers Matter Atlanta. And if you can go to the next slide, Thomas. Thank you so much. We'll hear from them here in a second. We're hearing our welcome right now, and then I'll hand it over to Dr. Rollins, who will present along with her team, Thomas Cotton and Lisa Humans. And then after they are finished with their presentation, we'll hear from some commentary. We'll hear commentary from Carl Root. And then we will have about 10 or 15 minutes left for questions and answers. So if you have any questions at any point during this presentation today, please locate the Q&A box at the bottom of your screen and you can enter your question in there. And we'll make sure that we save some time at the end of today's session for that. So with that, I believe Dr. Rollins is starting us off here. So they'll introduce themselves a little bit more and then talk to you about their funded research project. So thank you, team, for joining today. And we're excited to hear about what's going on with your research.
Yes, thank you, Carrington, for the welcome and introduction. Thank you all for joining us today to hear about this project we're so excited to be working on. And so I'm Latrice Rollins. I serve as the principal investigator for this project, and we call it RUSH, and we'll get into what that means in a moment. But I am an assistant professor at Morehouse School of Medicine and also in the Department of Community Health and Preventive Medicine, as well as the Prevention Research Center, and also serve as the lead convener for Fathers Matter ATL. Proud to be back in the Robert Wood Johnson Foundation family. I'm a former cultural health leader and always looking to advance equity for African American fathers. And I think I'm going to pass it to Mr. Cotton, who is going to introduce himself.
Good afternoon, good morning. My name is Thomas Cotton. I'm the founder and CEO of Redemption and Advancement Alliance, where our mission is to disrupt the cycles of incarceration by helping people overcome their barriers by creating a blueprint for their life. I also serve on the Morehouse School of Medicine's Prevention Research Center's Community Coalition Board. I've been the vice chair on this board for a few years. I am the project manager for the RUSH project that one will speak about today. So I've been in the prison reentry field for over 20 years and just love helping people overcome the systemic and structural barriers that they face in life.
Okay. Lisa?
Hello, good afternoon and hello everyone. My name is Lisa Yomis and I'm the founder of Change Gonna Come. I'm also the administrative assistant for Redemption and Advancement, and I serve as the project coordinator for the RUSH project.
Go to the next slide. All right, so as we mentioned, we are all a part of Fathers Matter ATL. And so in January of 2021, Morehouse School of Medicine, particularly our Prevention Research Center, was invited by the Georgia Department of Public Health and their fatherhood initiative to serve as a lead agency for their community mobilization approach, which was a way to promote and support father engagement in Metro Atlanta. And so Morehouse School of Medicine, Public Health Department, and as well as a number of community partners work together to adapt and implement this approach that was initially developed by the National Fatherhood Initiative. And it included doing a community assessment, hosting a fatherhood leadership summit, and then anchoring or establishing a mobilization team or initiative. And so as you see, this image here is the result of brainstorming that happened during our Fatherhood Leadership Summit. It happened virtually with about 180 leaders in various sectors, from law enforcement to social services, public health, fatherhood, just meeting together to learn about various strategies or brainstorm various strategies that were needed to promote and support father engagement. And so this graphic recording of our Fatherhood Leadership Summit serves as a map towards the vision of having systems that serve fathers as well as they serve mothers and children. And we came up with 7 strategies. And the one that this project, the RUSH project, is born out of is the Addressing Mass Incarceration strategy, because many of the participants during the Fatherhood Leadership Summit talked about the impact of having a criminal justice background and getting access to various services, as well as being able to, reunite with their families and with their children. And so this particular strategy was important. And I asked Thomas to share just how housing in particular became a central focus for the Addressing Mass Incarceration Action Plan.
So as Latrice mentioned, there's 7 different strategies within Mobilizing Fathers Matters. The ending mass incarceration took on the challenge of housing because there was an individual that was going through the different strategies, trying to find housing for him and his child. There's an emergency need that they had, and we wanted to be able to meet that need. And the different organizations that we are connected with, there's a lot of different organizations. None of us could find emergency housing for this father with his child. And so as we kept going through, we eventually found a solution for this father, but we realized that there is a significant gap in housing fathers with children in a shelter or other places, because there's shelters that will accept men but won't accept men with children. And there's other places that will accept, women with children but not men with children. So there was just a significant gap, and we wanted to be able to research and find out what are the significant barriers to a father getting housing with their child.
Thank you. And now Lisa is going to share a bit more about homelessness among fathers, and particularly Black fathers. And she'll tell us a bit more about that.
Make up 13% of the general population, but more than 40% of those experiencing homelessness. The disproportionality of homelessness is a byproduct of systemic inequity. Also, the lingering effects of racism continue to perpetuate disparities in critical areas that impact rates of homelessness. Other causes are poverty, segregation, rental, housing discrimination, access to quality healthcare, and incarceration. So although services and policies addressing homelessness in the U.S. continue to expand, fathers experiencing homelessness remain an underserved subgroup. And this is in part because providers serving homeless families generally focus on women and children. And an example of this will be that many shelters serving homeless families do not welcome adult men or male children ages 12 years and older. So research shows that most of the homeless population are men, and 41% of men who are experiencing homelessness are in fact parents. Only about 16% of sheltered families include a father. Excuse me. And this goes back to the previous example of most shelters serving homeless families not welcoming adult men and or fathers. And this is also due to the lack of accessible services and lack of coordination among shelters, organizations, and government agencies to help father families in need. And then lastly, there is only one shelter in Atlanta that accepts fathers with their families.
Lisa, you can walk us through the goals for the project and objectives.
Okay. So the goal is to end homelessness of fathers in the metro Atlanta area. And our objectives are to identify strengths and gaps in the existing homelessness response system to improve service coordination and screening and linkage to housing, health, and social services for fathers, and explore barriers to access and safe housing for fathers. Also adapt our existing systems to facilitate the identification of fathers experiencing homelessness, known as B&L, and linkages to housing and services in the homeless response system, and then to examine the feasibility and acceptability of the adapted system and alignment approach through a pilot study with fathers experiencing homelessness served by our medical, public health, and social service providers.
Thank you. So with everything that we do as a team, not only through Fathers Matter ATL, but also Morehouse School of Medicine, we embrace a community-based participatory approach. And as you see there, it is typically called CBPR, Community-Based Participatory Research. This model really emphasizes the partnerships and really making sure that individuals who are directly affected or impacted by the issue are integrally involved in planning, implementing, evaluating, and sharing whatever it is that we intend to do. So if it's an intervention, if it's a research study, folks that are directly impacted and affected by the issue are involved in every phase of that process. This model really just kind of lays out how important partnership is to actually getting to the outcomes of whatever your research or intervention is. And so in our particular project, this really was important for us to have that grounding with the Fathers Matter, the Addressing Mass Incarceration group, which consists of multiple partners across sectors, not just those that are in the criminal justice field, but folks from social services, public health, et cetera, who are interested in who serve this population. So it's important to just really have that context and also understanding, that balance of power and decision-making that can typically hurt a partnership, particularly when we're looking at community and academic types of relationships. We really want to make sure that we are embracing everyone's expertise and everyone serves as a leader and a decision maker throughout the process. So really that context in which the issue is being studied or the issue is an intervention is being developed is really important and leads to how well or not your partnership process will evolve. And so in this partnership process, there's a number of other factors to consider, who's a part of the partnership. And as you see there, they have, community-based organizations, the funders, the agencies, government, healthcare, et cetera. It's the same, with our project here that we'll be talking about today. There's a number of different partners who are involved, and it's important that we establish, trusting and equitable relationships in order for us to get to the types of outcomes that we are seeking with this project. And just making sure, again, that we're integrating the community's knowledge and those folks who are directly impacted by this. So we have individuals who, of course, represent the medical, social services, and public health sectors, but we also have fathers who represent father-serving organizations, but also fathers who have experienced homelessness to be a part of what we call our RUSH coalition. And so RUSH, we've been saying RUSH, but it is research to understand systems for housing for fathers. And that's the RUSH acronym that Thomas came up with. He's good with doing that. I let in any project that we have together, I'm like, come up with the acronym for it because that's his gifting in that area. So the RUSH project and our RUSH coalition consist of partners, of course, across these sectors, but also fathers who are serving in organizations, but also fathers who have experienced homelessness. We meet with them bi-monthly to share our methods and our plans, share our progress, and eventually we will be sharing our outcomes with them. This kind of helps us with this community-based approach to really foster and facilitate coordination among the partners. They get to hear each other's challenges and successes. They get to hear each other's feedback and opinions and perspectives, and they can respond to each other in real time, which is why this community-based participatory approach has been found to be more effective than some traditional research approaches in terms of translating research into practice, because you have the folks who are doing the work right there with you and getting the information firsthand. Thomas, I don't know if there's anything else you want to add about CBPR.
Yeah, so this approach, the CBPR approach, when we started thinking about what I shared earlier, as far as us seeing a need, we saw a need, we know that there's a need, but being able to add community partners into it helps us to understand the need a little bit better. These are people who are boots on the ground. They're people who work in collaboration with one another. They see some of the barriers and they're able to help guide the research that we're doing. Not only do we share back information with them, but they also input the information to us that helps us to do our research, do specific research, ask the right questions, to get the right answers. So it's good to have a community perspective on this approach of RUSH, because we can just go after it. And a lot of times with research, there's a lot of information out there we could find, but what better information to have than those who are boots on the ground and those who've experienced housing challenges. And so we definitely want to have community partners from all aspects, not just the ones you see on the screen right now, but those who have been housing challenged and those who work directly with this population. So with our systems alignment approach, we want to talk about functional zero and absolute zero. This systems alignment approach is, it's the concept of, it describes a way to getting toward homeless. Functional zero is a concept used in the field of homelessness to describe a state where individuals experiencing homelessness are reduced to a level that a community's homeless response system can immediately and effectively address. It does not mean we completely eliminate homelessness, but rather achieving a state where homelessness is rare, brief, and non-reoccurring. So we want to make sure that as we're looking at our fathers and the challenges they face, we want to mirror this system of functional zero that emphasizes the importance of having a system in place that can quickly identify and provide appropriate support to the individuals who become homeless. So we want to ensure that they have a swift exit from homelessness and are able to obtain stable housing. Through the approach that we have, we want to coordinate efforts among various stakeholders, including government agencies, nonprofit organizations, service providers, and community members. And we'll talk about the linkages and how we're going to coordinate these efforts a little bit later in the presentation. But to achieve functional zero, communities typically implement a housing first approach, which prioritizes providing immediate access to permanent housing for individuals experiencing homelessness without preconditions such as sobriety or employment. This approach recognizes that stable housing is a fundamental requirement for individuals to address other challenges they may be facing, such as mental health issues and, or substance abuse. The beauty about the community-based participatory approach, CBPR, is that we address the social determinants of health. And so by having this team, we can also determine other factors and how to address those other factors. So we have a community working toward functional zero, so we can establish our coordinated entry systems. We can officially match individuals with the appropriate housing and other supports that they may need. We also are looking to figure out ways to develop affordable housing options for fathers experiencing housing challenges. Fathers experiencing housing challenges are no different than anybody else who wants to just see safety for their children and for themselves. And so we know housing is a big part of that. So implementing prevention strategies to avoid homelessness in the first place is one of the eventual strategies we want to get through the functional zero approach. And this allows us to address the other systemic factors that contribute to homelessness, such as affordable housing, which we know is a big issue, especially as of late, how much rents have gone up, how much housing prices have gone up. And so if you're already behind and you're already experiencing poverty, or other challenges financially to try to get into housing would be a bigger challenge now. So there's inadequate social support. So we want to make sure that we're using this functional zero approach to end homelessness and to eventually get to that zero approach. There's been 7 different communities that have done this. So it's a person-centered approach and data-driven approach. And so that's another part, is gathering the data that's necessary to be able to walk with the individuals. And we'll talk about that in a little bit. But when we think about the functional zero for veterans homeless and 4 communities functionally in the 4 communities that functionally ended chronic homelessness, we know that this is the model that we want to use to begin to move forward. And Dr. Rollins is going to talk about the by name list, which is the way we're going to begin to address this homelessness situation for our fathers.
Yes, and so this is the critical piece of the functional zero approach, and it also distinguishes it from a lot of other kind of homelessness responses where you are being very person-centered, very person-specific, knowing those individuals who are experiencing homelessness in your community and what are the particular issues, root causes, and particular issues that they may need assistance with, instead of a blanket kind of approach of, just kind of shepherding folks in one singular way, but really understanding what are some of the real needs so that you can end this particular issue for this individual. And so there's a number of different ways or steps in this process. As Thomas talked about, we really do want to make sure that we get the data. It is particularly hard because a lot of the data, particularly in the point of count and a lot of the homelessness response systems, are aggregated. And so we have already started to work with our City of Atlanta partners to figure out exactly how many fathers are in the system, whether they are a part of a family in terms of co-parenting, or whether they are single fathers with children, just really disaggregating that data so that we have an accurate assessment of how many fathers we're talking about and what the real issues are. That is not something that's publicly available, which is a part of the issue. If you don't have the data to really address some of these issues, or know that there are issues among a certain population, you're not aware of the disparities that exist and how to address them. So a big piece of this approach is really getting accurate data from the systems, but also going out and speaking with individuals who are experiencing homelessness to understand what those particular circumstances are and how what resources they need, as Thomas was saying, with this coordinated access. And you notice that the use of coordinated access is intentional as opposed to coordinated entry or coordinated exit. It's a coordinated access system that makes sure that you are truly understanding what an individual needs and following them for a good bit of time to make sure that the issues have been resolved. You can go to the next slide, and I'll talk a bit more in depth about all of the steps that are contained in the by name list, because like I said, this is the critical feature of this approach. And so we've talked about what the by name list is, essentially, making sure that you have a intake or some record of individuals who are experiencing homelessness and the particular issues that they are dealing with. You're also going to make sure that you have a local team and make sure that you understand, exactly who is going to lead and host this by name list and continue to collect the data that contributes to that list. What geographic area you're going to focus on. For us, it's Atlanta, the Atlanta city, because that is what our particular homelessness management system focuses on and has data for, is the city of Atlanta. So that's where we are focused. You want to make sure you clarify who is going to be on your list. For us, again, it's a subgroup. We're looking at fathers, and particularly Black fathers who are experiencing homelessness. You want to make sure that you engage with providers and build community will. Make sure that you're building buy-in. So it's important to communicate why and what this by name list is, why it's important to collect these type of data, make sure that you're providing opportunities for feedback from those providers or from leaders in the community, so that you can continue to refine the process so that it can be effective. Thomas is going to talk about, the data infrastructure, like how do you create this system that will use the by name list to, again, make sure that needs are being met. You do need to also make sure that you have consent, of course, of the individuals who are going to participate in the by name list and eventually the coordinated access system. So working with our RUSH coalition and committee to make sure that the questions that we're asking are appropriate and will get us the type of information that we need to effectively address the issues. You will need a set of policies and protocols because we don't want to just do this by name list once and that's it. It needs to be regularly updated. We need to figure out who is going to be in charge of regularly updating it and things like that. So those are the various policies and protocols that need to be developed ahead of time. They propose having a registry event as a part of your by name list. So really going out and deciding, where we're going to go in the city of Atlanta to talk to folks that are experiencing homelessness. Are we going to go to shelters? Are we going to go to certain streets? What are we going to do to make sure that we can populate the by name list? And then using that list, once it's developed, to, again, coordinate access to housing resources, but also there may be some other social supports that are needed to really support those individuals and those fathers and their families. We want to make sure that once the list is developed, that we have a quality list and continue to sustain and improve it. And the folks that have developed this built for zero or functional zero approach have so many templates, and we have the links and things like that at the bottom of our slides that you all can refer to, but they have developed a number of templates, scorecards, different tools, toolkits that you can use to really make sure that you have a quality list and a quality approach to addressing homelessness in your area. But we are looking forward to using developing and using this by name list to really support system level monitoring as well as improvement.
So as we continue through this process of learning and getting the by name list, we need a way of coordinating the access. We need to make sure that we are following through. We don't want people to just get lost in the system. A lot of times in the work that we do, we definitely have great intentions up front, and we have the great intentions of helping people overcome a lot of their challenges and barriers. But when you have a linkage system, sometimes it can get lost and stuck on an organization and don't get the full support that they need. So this coordinated access system, as we talked about, the coordinated access, it's going to integrate. It's an integrated system that provides the key services for someone who is experiencing homelessness, needs for as long as that person needs them. So they have resources as long as that person needs them. It's a way for communities to bring consistent support and help to the person who's experiencing or at risk of homelessness to access housing. And within the metro Atlanta areas we're focused in for our research project, but this can also be used in other geographical areas. So we want to make sure that we have the housing first approach, as I mentioned before, real-time data about supply and demand for housing resources. So we want to make sure that there are different if there are different shelters or houses or homes or places that will accept fathers and their children, we want to make sure that we have real-time data, knowing that we can contact them and we can say we have a person who's available, or an organization who's a part of the system alignment approach can contact them and say, there's a person that we're working with now. So this streamlined service delivery approach with access points to service, it creates a standardized workflow for triage and assessment, prioritization, and vacancy matching referrals. What we do understand is that achieving functional zero is a continual process that requires ongoing efforts to address the root causes of homelessness and maintain an effective homeless response system. So this response system is what we're looking at in ways that we can that this system can help to achieve that functional zero. The by name list allows us to understand who's in the process and really put a name to the face and not just have a person going through a process. So the comprehensive lists and linkages to resources and people experiencing homelessness is available to them. There are many people who are justice involved. There are fathers who've had justice involvement, so they have additional barriers. And so we need to be able to make sure we have key services that for those individuals who are experiencing homelessness with children also. And so we'll have a dashboard which allows organizations to have their own workspace, but also each workspace can be coordinated to engage other organizations. And so in this networking space, the client is engaged, other organizations can be engaged, and reports can be made. And so we want to make sure that not only are we supporting the people who are experiencing homelessness, but we are also gathering the data. We're finding the different resources. We're empowering other resources to be able to provide the support that is necessary for those who are experiencing homelessness. And with that being said, this is a part of the presentation where we have our commentary from Mr. Carl Root. He's going to come in and give some commentary regarding the system alignment approach and the way we look at engaging fathers who are experiencing homelessness and being able to put additional around them. So, Mr. Root.
Well, greetings, family. I just want to share that as a certified lactation counselor, the overriding goal is to make sure that the baby is fed. We are making sure with this collaborative that our fathers have the resources that they need to adequately care for their children. And this particular approach is something that has been needed for decades. However, it's right on time. It's been something that I have been, as a fatherhood practitioner for over 30 years, and one who has experienced many of the ills of this society: unemployment, homelessness, justice involvement, many of the ills that our society faces. Responsible fatherhood really is the answer to many of the ills that we face. If we can support a father, especially in securing his basic needs, just the basic needs like food, clothing, shelter, which we're talking about today. If we can secure, support, and encourage a man in those areas, he's better able and better positioned to be able to provide, protect, and prepare his family and children for success. And this housing piece has been a nemesis. It's been a thorn in my side for many years as I've been working with fathers throughout these United States, and especially in Georgia, where Georgia lags behind in many areas, and especially as it relates to mass incarceration. We tend to have many justice involved fathers in Georgia. About 90% of the men in jails and prisons in Georgia are fathers. And I've had an opportunity to engage them in visitation programs, which these men are just like you and I. What's the difference? How can you tell a man who is justice involved or formerly incarcerated versus a man, just an average man on the street? Well, you really can't. And what we have to do is we have to make sure that those who are justice involved, once they have served their time, that they don't continue to do a life sentence on the outside. And that's what's happening in America. Well, especially Georgia. I know more about Georgia, being a Georgia citizen. In America, 1 out of 32 of its citizens are under some form of correctional control. But in Georgia, it's been 1 in 13. And that presents a barrier, especially for those men who, like I said, 9 out of 10 are fathers in Georgia. When you're justice involved, that's a barrier in itself, because now you have to deal with employment barriers to employment, education, and housing. In the housing, my own personal experience was when I was a young father, and this was over 20, 30 years ago. I was being just as involved, especially with a marijuana charge for possession of marijuana with intent to distribute. My wife and I, with 5 children in tow, was seeking housing. But because of my justice involvement and that marijuana charge, there were housing developments that did not allow any felony convicted persons or especially drug related crimes. So I had to seek out every way that I could to find stable housing for my family and I. And of course, we had to do whatever we had to do. So we ended up in some pretty nasty environments. However, because of my own tenacity and because of all that I knew I had to do in order to secure my family and I did whatever I had to do by seeking out programs. Programs like, oh man, I wish there would have been a Fathers Matter ATL at that time, because it is the answer to a lot of the ills that a lot of fathers are facing today, because it is that multi-sector approach where you have a system of care where we're able to address the various needs, and there are many. Housing is just one of them, but again, it's one of the most pertinent, because again, you can achieve other things. You can achieve other. I mean, you can grow in other areas when you have stable housing. You know, you can deal with other issues like personal development, personal hygiene. You can deal with education and other issues when you have stable housing. So that's just one critical needs area. And we've been experiencing in the Atlanta metropolitan area for quite some time. So when I came on as a part of this collaborative, I said, yes, I'd love to be a part of the housing initiative, because it's something that we need to minimize homelessness or eliminate it altogether. It can be done. It's just a matter of all of us putting our hands and our heads and our hearts together to ensure that the needs of these men are met just like anyone else, because I'm a firm believer that's what's good for people is good for people. All right. And as I live by that mantra, I'm beginning to see the quality of my own life improved, because I seek for my brother what I want for myself. And that's the approach that we're taking at Fathers Matter ATL. The housing initiative is big. And when we solve that particular problem for our men and fathers here in Atlanta, we're going to be well on our way to solving a lot of other problems, because, you know, there are so many things that are attached, so many issues that we have to deal with, like the social determinants of health and mental illness and substance abuse and, you know, low to no employment or adequate employment, substantial and livable wages, and these kinds of things. So glad to be a part of this housing initiative, and we're looking forward to moving the needle towards closing the gap with the barriers and those things that hinder men, especially fathers, from being the best men and fathers that they can be. That's commentary from one who has experienced many of the ills of this society and seek to eliminate or to minimize men having to face these barriers in the future. Thank you for allowing me to share, and I'm looking forward to continued engagement with you in this effort.
Carl, thank you so much for that commentary, for speaking that truth, and being so vulnerable and sharing your own story. I think it's oftentimes kind of hard to imagine what these systems are actually like, and so that those real life stories make it more tangible. And that was just really impactful. Thank you for sharing, and thank you to the research team for talking about your project. I love this work that you're doing and the multi-sector approach and the holistic approach of really addressing the root causes here. And it's so important, and housing is a human right. So I love the work you're doing, and I'm really excited to learn alongside with you as your Systems for Action project continues. So with that, I see Thomas has switched us to the questions slide. So I think we're going to move into our Q&A section here. If there are any questions that you have, please enter them into the Q&A box at the bottom of your Zoom screen. I do see that we have a couple here, so we'll get started answering those. And I'll start out by saying you're getting a lot of love here in the questions and answer box here, team. A lot of people are saying the work you're doing is wonderful, phenomenal efforts. Let's see here. I'm going to start with a question from Ann Stone. Had you done an environmental scan to know your housing capacity for fathers? You indicate there is only one shelter that serves dad or serves dads. In our state, we don't have that data. Can you and your team speak to that a little bit?
Yes. So this situation Thomas spoke about earlier, when the young man came to us, we started in this direction of providing houses. And one thing that we did was to compile an emergency housing resource list. And in doing that, I contacted shelters, did some research in the Metro Atlanta area. They are shelters there, but the thing about it, like I said, we only have the one for fathers, but then there's other like stipulation concerning different shelters, especially when you talk about men and or women that are coming, re-entering society after incarceration. That was a barrier for that. And there was different things like some shelters don't accept that, or some shelters don't accept sex offenders, and different things like that surrounding the issue of incarceration. But I think we may have a list of maybe 30 to 35, even 40 shelters that we was able to find that were what we call justice impacted friendly for those individuals. But even in that, it depended on what your issue was with being justice impacted. So there were shelters there, but not all serve fathers that are dealing with what we are dealing with those that are dealing with incarceration, such as what Carl spoke about.
Yeah, so this is a constant check, it constantly scanning to see and getting resources from the community. If they find another program that may be a good fit, we're constantly collecting that information to make sure that we can, provide resources to dads. And the shelter that Lisa is speaking of, it's not just a shelter for dads, it's just one that will accept fathers that have children. Right. So that's really the issue is, whether they will actually accept, and then two, do they have space, right. Yeah, that's usually the challenge.
Thank you both for answering that question. The next one that we have here is not really a question, but I'm gonna go ahead and just state it here, and maybe we can turn it into a question, or maybe you have some commentary on it. Daryl Jones says, I have two shelters in Winston-Salem that serves dads, but they get kicked out of the shelters by 7 a.m. with or without children. So I guess you could comment maybe potentially on like these shelters are not really addressing like services or connecting those fathers to services, which is part of the research project that you're doing. So it's more of just a comment, but I'm curious if you have anything to say about that. And
I'll say something. A lot of times shelters, that's their structure. They have a time in, a time out. They want you to try to get out and get off on your own. When you send a person who's experiencing homelessness out during the day, you expect them to know exactly what to do, or they expect them to know exactly what to do. A lot of times they don't know what to do. They get minimal resources to go check into throughout the day, and those resources sometimes don't pan out, which then breeds a lot of frustration with the person who's trying to figure out what they need to do. A lot of times we see people who are experiencing homeless who are sheltered, and they have to go in and out of these shelters. We see them on the streets throughout the day, and then when the shelters opens back up, they're in line ready to go back in. Our approach is to hopefully help people who are experiencing this, that if there is a shelter that provides housing or shelter for a father with his child, that we have additional resources for that father to be able to go and be equipped in order to overcome the barriers that they're facing on getting sustainable housing or long-term housing. And so a lot of shelters, this is their policy. They do not allow people to stay in the shelter beyond a certain time during the day, and they can't return before a certain time in the day.
Mm-hmm. Yeah, so I think with us having these discussions early on with our medical, social services, and public health partners, a lot of them that do work with the homelessness response system, getting a good understanding of those policies and procedures and some of the challenges. And then they also get to hear, as you all are now, hear from fathers who are part of our RUSH coalition to talk about, the way that some of these systems are set up. We're hoping that there can be some changes that are made, particularly, when you do have, parents who can't necessarily leave their children, or they have some challenges with childcare or whatever the case. But, looking to see if that is really a fair policy, or, what can be done to make sure that folks just aren't out on the street, with their children because they were kicked out of the shelter very early in the morning. And that, that goes across the board, as Thomas said. It's not just for men, that's women, anybody. Is a principle in a lot of shelters, but yeah.
Thank you both for commenting on that. I'm going to move to a next question that we received from Jake Kennedy. How can public interest attorneys best serve you and the needs of your organizations?
In all areas. There's so many things, unfortunately, that, like Carl brought up, that we are dealing with beyond the housing. I mean, there's so many issues that fathers face, and that could piece of doing that mining list and understanding what are those particular specific challenges that each person is dealing with, and a lot of times, or some other type of civil rights violation or issue that they really need legal assistance with. Sometimes it could even be around parenting, visitation, and custody type of things. There's so many different issues that we typically need legal assistance to help our fathers with.
The other thing is, we are a bunch of organizations who have come together to form Fathers Matter ATL, and there may be some legal things that we cross over into that we want to make sure that we stay out of the crosshairs of the legal system or whatever, that we can actually do this the right way. Attorneys are a big help to what we do, because there's policies that we're looking to change, there's narratives we're looking to change, and then there's also connections that attorneys have to systems of care that we're looking to be a part of. So there's a lot of other ways that attorneys can be a part of this. So what we would do is definitely talk to the attorney and figure out where their strengths are, and the capacity they have to support what we're doing as a whole.
So Jake, it sounds like this might be your area of expertise, and maybe you want to connect with the research investigators after this presentation if you have some services you'd like to offer. I had to turn my video off because my internet is being unstable, so apologies for that. We have two questions that came in from Jose. One is kind of a comment for you, Carl. So he was saying he learned about ROBE at a recent conference. Great work you're doing. He loved the Basketball Dads program and the early relational health that you use. So maybe you could speak to that after his next question, which I'll pose now. He says, I think Thomas may have mentioned some work they do to help fathers create a roadmap for dads. Could you share more on that and any programs that use this model?
Yes. So with the way we approach disrupting the cycles of incarceration and poverty is by helping the person become a better person. A lot of times when we look at systems of care, it's like we want to get people to another place, which is admirable. We want to get them a job. We want to get them housing. We want to get them to a place that we feel that can help them elevate. But if the person hasn't changed, or the person doesn't understand how to put the resources together to build from there, then they can mess up all the resources. And we've seen that happen before. So I wrote a curriculum called Rethink Life. And what Rethink Life does is it helps us put our experiences in perspective and to really honor the gifts that we've been given when it comes to our own personal lives, the stories we have, as well as the resources we will receive. How do we use all that to help elevate our life? And so the most important part of any transformation is the person. It's not what they can get, it's who they want to become. And so we help support them in really overcoming the personal barriers, the systemic and the structural barriers that they may face. And if you want to know more information, you can just get in touch with me. And I'd love to be able to walk you through it. I even love for you to just sit in on a class and listen to the difference between that we have with this training versus a lot of other trainings that are out there. It's an eye opener. It's different, but it really addresses the needs of the individual and not just what we think they need, but what true needs that they have.
Yeah. And Thomas, I think we can definitely make sure that your email addresses are included in our follow-up communication. And then if you're also interested in sharing more information about that curriculum, we could include that in our email communications.
Thank you.
Yeah.
And thank you for the comments regarding ROBE. ROBE, reaching our brothers everywhere, where our mission is to educate, equip, and empower men to impact an increase in breastfeeding rates in the African-American community and a decrease in infant mortality rates in the African-American community. But we do this by espousing safe sleep information and the benefits of breastfeeding. Now, in that role, I get an opportunity to speak with many men from various walks of life. And because we're talking about breast milk, we're talking about the benefits of breastfeeding, and we're talking about maternal and child health all together, we have to use innovative ways to engage our men. And as Jose mentioned, we use hoop therapy as one of those platforms. It's a platform that on a weekly basis, we'll have men come in to play simply basketball. And again, as I mentioned, culture for young, energetic Black men, we engage in athletics, and basketball is one of those. So we use the hoop therapy platform. But what we do is we provide information regarding, because a lot of us are not really involved in that aspect of our relationship. When the woman gets pregnant, it's like she's pregnant. But because we're seeking to reframe the narrative, we're saying no longer is she pregnant, is we pregnant. Okay, that's that four hands approach that we're talking about, and it lends to a much stronger bond in the relationship. Not only that, it benefits the child and the family and the community as a whole. So we use that hoop therapy platform as one of our greatest offerings for our men to be able to engage them, because sometimes it's hard getting bodies in the seat, especially since COVID. But also on another platform, we use Boy, Man, Father. This is a platform where we engage men twice a month. Once a month, that fourth Thursday, we do it virtually only. We have reformatted, but Boy, Man, Father is engagement of men, intergenerational men, as the name itself entails. Boy, Man, Father, from all different walks, all different stages of development, where we engage each other on, we talk about what ways can we better protect and serve our community, our women, our children. What can we do as men to say, not on our watch, we're not going to have higher deaths among our women, our birthing persons. We're not going to have our babies dying at higher rates, not on our watch. So we're learning what it means. And that's what we're doing at ROBE. We're teaching men to embrace saving our women and children by espousing evidence-based, research-based information, teaching them what it really means to be a protector, what it means to be a provider, what it means to be that true partner who has the best interest of that birthing person and everybody that's involved in that ecosystem. So that's what we do at ROBE. Thank you for shouting us out. And we're glad to be a part of this ecosystem, because I'm telling you, the Fathers Matter ATL collaborative is going to be a model for not just the country, but for the world. I truly believe it.
Thank you so much, Carl. Hoop therapy. I haven't heard that before. I love that term.
Yeah, we're doing it over here.
I'm going to move to a question from Nell, who received their first HUD grant to operate a transitional housing program for homeless fathers and children in Minneapolis back in 1996. It was called Fathers and Children Together, which acronym for that is FACT. They rented apartments across the Twin Cities and offered case management services, including purchasings and startup furnishings. They provided dignity, privacy, and freedom to raise their own children. The grant was $16 million for 3 years. Could we try this approach today over the option of shelters?
Yes, would love to. Would love to. And I want to be clear that, one, this housing project, although we've talked a lot about justice involvement, it's not only for justice involved fathers. We're talking about all fathers who are experiencing homelessness. And we're not only focusing on shelters, but any resources, any housing resources in Atlanta that can help these dads where they are. So if there are programs, where they have apartments or whatever the case, like Lisa said, we have scoured and scanned and tried to find these various programs where we can refer fathers to. So yes, it's not limited to just shelters.
Thank you, Dr. Rollins. Let's see, I bet we have time for this one last question, and then we can move on to a couple of quick announcements that we have. This one is kind of hitting on a point that I was actually going to ask if we were at the end of our questions. So thank you for submitting this. And one thing I didn't mention at the beginning of this presentation is that this grant is a developmental grant. So it's pilot testing, and we have this research team for 1 year. So my question was going to be, what next after this 1 year? What are your plans? And I'll kind of blend that into this question that we received, which was, how far along are you with implementation? And do you have any thoughts about scaling in Georgia beyond Atlanta?
Yeah, so we are just in our beginning phase of talking with the various medical, social service, and public health partners to understand their systems and things that they have in place. So we're just getting our IRB approval and all of those things so that we can start those interviews with them. We have already collected some of that data from the homelessness management system here to understand what it really looks like in terms of the fathers who are experiencing homelessness here in Atlanta. And I think Thomas is looking at getting our database together, right? So that we'll have a space for that by name list. But because of the work of Fathers Matter ATL, it really, like Carl said, this is beyond Atlanta, it's beyond Georgia at this point. So anything that we do, I'm sure we can continue to scale beyond the metro Atlanta area.
One of the big things that we're doing is the things that we did from the grassroots using Fathers Matter ATL. This is a work that we see that is worthy of multiple organizations coming together already to figure out ways to support fathers as mothers are supported and when it comes to fatherhood. So we are in the process of really engaging fathers and helping them to become better fathers, to become supported, to help them stay engaged with their children. And so there's a lot of work that's going on. We hope that this lays a foundation where after we gather this information, we can gain additional funding to continue to move forward in this work that's so necessary and needed, because there's space, as what was put out there, that there's grants out there that can help fathers get sustainable housing. And so we just want to make sure we can structure what we are doing here with this grant so that we can find ways of putting families back together, of supporting children in their growth, and putting fathers in the position to be fathers to their children in a better way.
Absolutely. All right. Well, thank you for addressing that. And thank you so much for joining today to present on your research. Again, this is this research team's first time presenting in our Research in Progress webinar series. So definitely stay tuned as their research progresses, and we'll have them back to provide an update near the end of their project. A couple of quick announcements. We do offer a certificate of completion for everyone that's attended today. If that's something that you're interested in, there will be a very, very brief survey at the end of today's Zoom session, and you can fill out that survey and indicate that you'd like a certificate of completion, and we will get that to you in a timely manner. Next slide. And then, like we mentioned at the beginning, this is an ongoing series. We do have our next Research in Progress webinar on June 5th. Titled Systems Alignment to Optimize Health Services for Youth Experiencing Homelessness. And our team from the University of Minnesota will be joining us to present on their research. Next slide. And that is all I have for you guys today. Thank you so much for joining and for engaging in this research, and for submitting all of your questions, and just for joining to learn about this research project. Thank you again to the team for presenting, and we look forward to hearing from you again sometime in the future. Bye, everyone.